Hello my friend, this is Dr. Ho. Welcome to this lecture. We're going to go over an important musculoskeletal condition, and we're going to talk about osteoarthritis, which is a topic for the chapter number 3 of the book Natural and Strength Condition Association Essentials of Training Special Populations. And there are different types of arthritis, but the most common is osteoarthritis. The abbreviation is OA as medical terminology. About the definition, is a degenerative disease that cause pain, swelling, and decrease the range of motion in the affected joints. And the most frequently affected joints are knees, hips, hands, and spine. And this disease is just like osteoporosis, with more common in women and than in men, and the risk increases after 50s. The etiology or causes are largely unknown, but include excessive body mass, obesity or overweight, structural misalignment, and muscle weakness. There are issues that are common with folks with to have osteoarthritis, but we don't know exactly. There is no cure about this disease, but we do have some recommendation on how to should handle it. And as an exercise professional, we must to understand this disease. And on the screen, we present some important factors, especially the prevalence of disability of this disease. It is very common disease, and the progress is slow. There are different forms, but the most common, as we talked before, is osteoarthritis. And we can read on the screen the common types of arthritis, and we can find rheumatoid arthritis with an autoimmune component, psoriatic arthritis affecting also the skin, lupus with an autoimmune component that also can affect vital organs, and gout is when uric acid crystallizes and deposits into the joints. And on the screen you can read some signs and symptoms, and we read that the morning stiffness lasting longer than 30 minutes, joint deformity, decreased appetite, fatigue, atrophy in the muscles. So there are different kinds of symptoms, and more is about medications. There are different medications for the treatment. In most cases is for relieving the pain or pain management, and more about medication are not opioid analgesics like glucosamine and chondroitin supplements, other medications that reduce inflammation or improve joint function like corticosteroids, steroid injections, and hyaluronic acid that help the lubrication. And about exercise, believe it or not, um, is painful, this disease, and exercise is beneficial. reducing inflammatory and pain, and also helps with hair reduction. But as an exercise professional, you're going to identify in the next slide that the principles exercise and design programs for this special population are almost the same than adult people without the disease. We just to do we must to just to be careful and personalize the program and exercise selection, creating programs with special for osteoarthritis limitations to help these people most effectively. We're going to summarize the recommendation in terms of the FIT principles: frequency, intensity, time, and type, FITT, and help with joint pain reductions, because it's the way that exercise helps reduction of pain, improve joint stability, and improve muscle weakness of people with these problematic disorders. We're going to consider resistance training, aerobic exercise, and flexibility. We're going to start with aerobic exercise. And the most important in aerobic exercise is to contract large muscles, including like swimming, cycling, or walking modalities, 3 to 5 days per week, at light to moderate intensity for 20 and 30 minutes, but the progression can be slow. You can increase to intensity with the time in the future. The other modality is resistance training or strength training. Is 2 or 3 times per week at moderate intensity. Is recommended that way. And finally, flexibility. This is recommended daily in different modalities. It can be a stretch, dynamic, or other modalities. But many times arthritis will accompany other disabilities, and in these cases always we make sure that other present disabilities don't have a contraindication to any exercise recommendation you might prescribe. So this is Dr. Hall, and this was osteoarthritis.